within the amount of people, about half the adults are killed because of leukemia, and about 700 children are killed a year. I know many people, you might know somebody or a family member who has leukemia or some sort of cancer, because blood and marrow transplant is a very common treatment used behind chemotherapy, because you have to go through chemotherapy before you go through blood and marrow transplant. But this is like more of a common treatment used in leukemia. Yeah, so as like a current employee at Children's Hospital, I worked in the hematology oncology unit, which is a unit for cancer patients for kids. So I would have to bring the children, and like sometimes there were like people who were 21 our age at this hospital, and I'd have to bring them to a room and inject them with their IV for chemo, and then I'd have to transport them to the blood and marrow transplant area so they can get their marrow, like new bone marrow, put into their body. So blood and marrow transplant is one of the major treatments used in leukemia. So now I'm gonna inform you guys of like the history and background, the process that the patients have to go through, and the positives and negatives of this treatment. Negative aspects of this treatment. There we go. So discussion and experimentation has been going on for hundreds of years, but the actual experimenting with patients has been going on for the past 35. The first blood and marrow transplant attempt was in 1959, but it failed. I don't know exactly how they attempted that, but then the first what's the word I'm looking for here? The first there you go, success. The first success happened in 1988 with two twin babies. One baby was diagnosed with cancer, but the other one wasn't. So they took the umbilical cord, and they took the blood from the umbilical cord, and they used that as like the blood and marrow. They took the blood from the umbilical cord, which was not harmful to the baby at all, and they used that blood to transfer to his twin brother when he needed it. So yeah. Now I'm going to tell, since I just gave you a brief history, like a brief summary of the history and the background of blood and marrow transplant, I'm going to talk about the process that we go through. There's 3 types of blood and marrow transplant. Allogeneic, which is basically they take the bone marrow from the actual patient that has leukemia. They take it from a part of the body that doesn't have the cancer in it, and then they just switch it out eventually down the line once he goes through chemo. And there's allogeneic, which is what comes from like a family member who has the same blood type or marrow type or an unrelated donor. And then there's syngeneic, which is a very rare form of blood and marrow transplant, because it comes from an identical twin. It has to be an identical twin because they have to have the same blood type and stuff. But so we don't get very many of those. Then now I'm going to talk about the phases. There's a pre-transplant phase, which is where you pick your donor, you meet your donor, you get to know your donor, and all sorts of stuff about them. And then there's the peri-transplant phase, is when the patient, as you can see, kid from Children's, undergoes chemotherapy. Chemo basically is just an IV, and they just run chemo right through you. You don't go to sleep or anything, so you prepare for the transplant with chemo and radiation. And then the post-transplant phase is basically the late and long-term effects that can affect a patient. That is a picture of chronic graft disease that is a side effect to allogeneic transplant. So now that I talked about the phases, I'm going to talk about positive and negative aspects of blood and marrow transplant. Well, the positive is basically blood and marrow transplant can save a life. If a patient's dying and they need some new blood or marrow, they can get it right away. And it can change somebody's life by saving them from leukemia or something, or curing them. But the negatives is, like I said, it can cause chronic graft-versus host disease, which is it gives lumps and bumps to the skin, and it can cause growth development for children. And chemotherapy that adults have to go through can affect their lives for a very long time. Yeah, because the chronic graft disease can mimic a collagen vascular disease, which isn't as bad. You can just use antibiotics to get rid of that, but some doctors get it mixed up because you actually need to go through very hardcore treatment to get rid of that. But for patients, it's really hard to go back to looking normal. Like, you can say like this is like normal, but when you get this disease, you come up with lumps and bumps like that, and those stay there forever. They don't go away. Conclusion. Since I just talked about the positive and negatives of blood and marrow transplant, I'm going to conclude it. So in conclusion, blood and marrow transplant has been around for over hundreds of years, and has been experimented for over hundreds of years. It can be a lifesaver, but it can also be a life taker. Yeah, it's also one of the most common treatments used in leukemia, along with chemotherapy and radiation. So now that you've learned the history, the process, and the positive and negative aspects of blood and marrow transplant, whenever you meet somebody who has leukemia, now you can inform them about the treatment and the ways that and how it will affect their life in the long run.